Yeah, I much appreciate it. Sorry being late, and I'm probably going to repeat some of the things.
Pull you up if it's...
Yeah, if it's all right. I had to go away. I had other business in the chamber, so that's why I had to leave. But I welcome you here anyway. And I'm not going to repeat what I said, but I was just wondering about the overrun, as I know it was discussed this morning. I know you answered questions on it. This 54 million that's been in the papers yesterday, the overrun up to date, which is 6 months in. And what you envisage will happen before the end of the year? Are we going to have another 64 million of an overrun for the second half of the year, which will come to 120 million? We know what happened in last year and the year before, where there was supplementary budgets had to be brought in during the year to keep the show on the road, if you want to call it that. And I just want to ask that first. Again, I know it's repeating, but I want to know, are the services going to be affected? We know about primary care services and care of the elderly, etc., etc. Are they going to be affected by this overrun? And when is the HSE going to get shown in order and get the monies that are allocated and live within it and still provide the service?
Thank you, Deputy. The report that we just published was for quarter one, which is an 82 million overrun with further charges taken in, just over 100 million for the first quarter. What I just set out was our approach to looking towards the rest of the year, and our commitment is that we were aiming to deliver the service plan and all the commitments in the service plan, and to deliver within our budget that's allocated. Obviously, after the first quarter, that's under pressure in terms of what the outturn might be.
Can I ask why is it under pressure? Where is the wastage, or where is the overrun? Where is the actual pressure coming from that you have to get this 64 million of an overrun?
Yeah, well, it was a lot more than 64 million last year, and 640. Put another zero on it as well. But just in terms of where the pressure has been in the first quarter, the breakdown of that is a combination between the acute hospitals, which have had significant pressures on them. Certainly their service pressures are up in last year, and indeed our community pressures, significant demands on for more home support packages and to be able to step down from the community. But to come back to your specific question, for the rest of the year, which we just outlined this morning, we are setting out for all the senior budget holders, managers in the acute hospitals and managers in the community organisation, a month-by-month profile for them for the rest of the year that would aim to bring them in on target. Now, we'll be looking at that as we go through each month now for the rest of the year. But that's a process that we're involved on, saying that we can't sustain the level of overrun that had happened last year. I agree with you. This year, this quarter, or certainly the first 4 months or so versus last year, it is better, but it's still an overrun and something we can't sustain for the rest of the year.
Can you give a guarantee here today then that from here on to the end of December that the budget is going to come in with it, and that we won't be at all bringing in a supplementary budget to keep the show, and as I said, the show on the road and keep the services there without adversely affecting the services that are needed?
I would really love to give you a guarantee. What I can give you is a commitment that that's the focus we've been putting on, particularly over the last few weeks. And you know, there was a challenge back earlier on about continuing to meet the service demands and the pressures that's on us. But our commitment is deliver the service plan that's committed, both for our acutes and communities, and live within the budget that we have for us. And that's why we're looking ahead month by month, to have actual spend limits by each hospital manager, by each hospital group and by each community organisation. That's the process we have in place. If there are certain service demands or pressures that are above and beyond that, for example, on current home care packages, we have demands well above and beyond even the extra budget that we got from last year, but we are holding to our budget and holding to our commitment that there will be 18 million hours committed, 17.9 million hours committed to over 53,000 people for home care packages, and to aim to live within that budget. Now, there are another 6,500 people currently looking for either enhanced home care packages, extra hours, or new home care packages, but we're aiming to hold it within the budget that we have. So it is meeting those difficult service pressures.
And we say the health department is one of the most expensive, we say, along with social welfare in the country, and you know, compared to other OPEC countries, I think our spend per person is way up there. But are we getting the value for money? I mean, I'm hitting the HSE here now. Are we getting value for money for the amount of money that's been invested? And every year it's increasing by a million, whatever it is, a couple of million every year. It's going from 15.5 up to 16.5. And yet we don't seem to be getting any better improvement in services. We still seem to have the waiting lists. We still seem, imagine when you're $3.5 million extra, and it's just passed every year, and that will help to relieve the pressure, not add to it every year. And more money being spent, but less progress and less value for money.
I understand your challenge on this one, Deputy, and exactly there. We've had continuous extra allocations of budget, and we're still under the service pressures that we have been for a number of years. So the key issue is you stand back from that. If we're to keep putting more money into the existing way we're doing the services, I think we'll keep getting the same answer.
That's the real answer. It's the same, more money, but the same level of
sure.
Why? And where is the wastage? Why is that happening? Imagine you get money, you should get value for it, and better value for it, and shorten the list, the waiting list, etc. And we don't seem to be getting there. The more money put into it, the less of the service, or the same, at least the same level of service are getting rather than an improvement.
Sure, yeah.
So there must be a reason for that.
I think the challenge is to get a better interaction and working processes between our acute hospitals and our community organisations, because currently we have a very stretched acute hospitals and emergency departments and waiting lists, and equally have a stretch on our community side. So it's the launch of care process, and the strategy and vision set out is to have a much more integrated care. So you're reducing the pressure on the acute side and increasing the capacity on the community side. So one of the challenges which I've set out with the team is to hold our budget for this year, aim to use better funds that we have more wisely, look at any activities or services that we're doing that are not adding value to the front line, stop them, and make sure the money is going into the front line where we need it. But separately then work with our departments and our colleagues in the department and government and saying, look, there is a requirement for an investment, and Sláinte Care sets it out, but in a new way, in a very different way of delivering services.
And can I ask you how are you going to marry that then? We're all, Kilkenny, wherever we come from, every hospital in this country is short of personnel, either whether it's nursing or professional personnel, doctors, etc. How are we going to manage that when we're trying to recruit more and they're all going to cost more money? Doctors, GPs in general around the country are getting scarcer. We're trying to attract them back. There's going to be parishes around this country. Already it's happening, I think, like a Mayo, where they now supply the doctors to one, which we normally have as one per parish, or maybe 2 or 3, or at least in a grouping in primary care kind of situations. How are we going to pay all these extra staff if and still live within the budget? How do you marry those two together?
Very difficult. The fact is, for the first quarter, we've recruited over 1,100 people. We were running at about 400, just short of 400 per month for the first 3 months alone. So there's a lot of recruitment going on in the organisation.
Can I ask then, if you had your full contingent of personnel, which you probably never have, but what kind of money extra would cost? Has that been worked out? Or is that known how much money to cost? If we say every hospital is crying out for nurses in particular and professional people, what kind of costs would be on it if you could get them?
Well, I think the Sláinte Care did some work in terms of bed capacity and what's needed over the next 10 years, etc., providing we do a number of things, and that determines numbers of people. But through the economic difficulties and downturn, there certainly was no room for recruitment. So we are playing a bit of catch-up, particularly in some hospitals and some community organisations, and that's required. But we can't keep recruiting at the level we're at. The budget that we have this year allows for certain recruitment of staff. We haven't put in place an embargo. What we've said is people and areas will continuously recruit once they have the budget for it and once it's an approved position within our service plan. So we now need to focus purely on those positions and make sure that we're not recruiting in other areas that don't have budget.
Okay, and what the old Chestnut did, the Children's Hospital, overcost, overrun, and the effect it having, I can name out here, I have it brought down me here from Kilkenny areas alone, the St. Columbus Hospital is a project that's supposed to come on stream in 2021, primary care centre in Thomastown, these are only all local ones. I could name out 5, 6, and 10 of them from Kilkenny alone. What way would it be affected? Like, no one seems to be able to tell us. The minister couldn't tell us today on the floor what's going to be affected or what's not going to be affected, and the health plan going forward. And something has to suffer, something has to be drawn out. If there's going to be an overrun of funding of $500,000 as we're talking, about, something has to be taken out of the plans that are projected to 2040. So how are we going to, again, who's decides what plans are being taken out and who's going to suffer because of the overrun of the Children's Hospital?
Yeah, thanks, Deputy. The capital plan for the HSE is quite significant, so it's about 640 million broadly. A large proportion of that's committed and contractually committed, about 75% of it. So you are dealing with a very reduced flexibility after that. The second challenge for ourselves is the issue you just mentioned on the National Children's Hospital and how that impact it's having on overall national capital budget and what implication that has for us in HSE. And the discussion that we've been having between HSE and the department has been what level of funding would be required from the HSE to support the extra investment needed in the Children's Hospital, and what implications on the HSE capital budget.
Now, will we know when that information be made?
That's a process we were just going through that is right now ongoing. We've earlier this week, and we certainly see hope in terms of the government economic statement, because it does set out a reserve for both the National Broadband Plan and the National Children's Hospital. So that would give us a better way of reducing the impact on the HSE's budget, and that's a process we're engaged with the department on at the minute, and we expect an outcome from that.
And will we know before the summer break up? That's only a couple of weeks away.
Certainly, as our intention as officials is to get it to that point. Obviously, it's a decision for government. Being from the South East, again, I just want to ask you about the 24/7 cardiac service in Waterford University Hospital, and I also want to mention the morgue down there, all the highlights about the morgue and the publicity it got. What is the present situation both? That's just being local now. I'm sorry, but when I have you here in front of me, I have to ask these questions. It's okay.
So on the 24/7 cardiology, there's a national review of cardiac services underway, and that will look at our current map of services and see what a sustainable map for that is going forward. We won't make any decisions in advance of that on changing current service provision, but parallel to that, the second cath lab in Waterford has been approved for and is already underway.
Will it be commissioned? Is already commissioned? No?
It's underway. An approval is issued on it. So that would do scheduled care.
So what's the time scale for that?
I can get you an update on that. Colleagues may have it, but 18 months.
18 months time.
Yeah.
Okay. And what about the morgue? I just want to ask a question. I know there's progress made down there since all the publicity and the bad publicity, I must say. And some politicians accept this as so bad, but we all knew it was bad. And what's the process there?
I accept the issue there. I did go down there on my second day in the HSE and met some of one of the pathologists and certainly some of the staff.
Who weren't believed in the beginning when they made their complaints?
Certainly, when I've met them, I think there was a good dialogue down there on the day, and thankfully the capital plan of 5.6 million is committed now. Procurement process commencing for it, and selection tenders will be following that to start there, hopefully before the end of this year. There are now.
Is that a new build? Is that a new build?
That's a new build.
And what's the time scale for that to be built?
I think it's 2021 overall. I have it here. Just to no, there's a better one, isn't it? I can come back to you in just a second on it, but you're familiar with the remediation done just on the extra refrigeration units that's gone in, and the ventilation as well, etc. I'll give you the time scale just on the. I'll give you time scale just in a second on the build. I think it's here. I'll come back to you in just a second. Just on the.
I just on the last one, Chairman, just on the fair deal scheme. The fair deal scheme that's been asked for business people and farmers in particular, being a farmer myself. What kind of cost is implemented here? The 7.5% property charge for 3 years. That's going to be the same as was in for heretofore for everyone else. What is that? Will that be rolled out? Is it being done retrospectively? And what's the costings? What kind of costings will it work? And in particular from the farming community, how will that fair deal scheme work on the 3 years, 7.5%? And is it going to be implemented straight away?
Deputy, I just got distracted to find it.
Sorry,
Mr. Connor might just ask. Yeah, can you take that, Chair?
The first step in terms of Waterford is that we have a review underway, so we have a 5-person review team carrying out a review and they'll make recommendations. We have the refrigeration units in, but I think we're awaiting the review, which will be in September.
September.
Just on the capital is there, as I mentioned. Sorry, the capital is there, 5.67 million.
That's ring-fenced, is it?
Expected construction completion will be Q1 2021.
It's ring-fenced.
5.7 is committed, ring-fenced,
okay.
Dedicated.
Just a fair deal then, that's
So
the last one.
on the fair deal, the government signed off that the heads of bill and Minister of State Daly intends to bring it through the House, ideally this year, if he's facilitated by the House to do that. So we will implement it in the current year. It will apply to people who are already in nursing homes.
If there's more than 3 years there, they'll qualify.
So with effect from the date of commencement, it will apply to everybody who's in a nursing home. So
and go back 3 years till we recognise the 3 years they were in, if they were in.
Yes, but it won't go backwards and pay people back.
Yeah, I understand it won't pay back, but the time that they're in hospital will be taken into consideration, or in the restaurant. And what kind of costs is it?
I don't have
any costs.
We do. We have full cost works out. I don't have a figure. It's in the low millions, maybe double figure low millions. I can get you costing on it. That will play out over time, though. So it will build up over 3 years to a maximum cost. So in 2019, it will be modest enough. And
the 7.55% will be on the home, on the farm, and on the incomes. Is that it? Just for clarification, the 7.5% for the 3 years will be on the valuation of the land, in particular farmland, the valuation of the land, the valuation of the home, and on the earnings that are coming from that. Just for clarification.
I'm open to correction on this, but I think the 7.5% relates to the asset.
The asset?
Yeah.
Not the income. So income be excluded.
Yeah.
No, it's
there's a different
100%
assessment.
Included.
Sorry, included, yeah.
It's 100% included.
Yeah, there's a different, the income is assessed in a different way, but the asset is subject to a 7.5%. Up to now, a farmer with a homestead, the homestead is exempt, but the farm, the remainder of the farm is not. What this will introduce is it will allow, subject to conditions, that the farm has to be handed on and farmed. The 7.5% will apply in that situation. The income will be a different assessment. So if you had a different source of income, say you had rental properties.
And the house as well, the house.
The house is already subject to that. Essentially, what's happening is the current relief for the home, in the case of farmers, is going to be extended more widely.
And a business person,
a small business person could apply too. It's subject to thresholds and conditions, but a small business person can apply as well, and benefit from the same.
And the business will be assessed in, isn't it?
The business.
Just wondering how it's going to be rolled out. That's all.
But all of that is provided for in the legislation, which will come before the House.
Okay, Chairman.
And thank you.